physicians can easily appreciate genomics if they just ask a couple of questions. One is, how can I use this information to benefit the patient, and what kind of information can I gain that I cannot gain by regular diagnostic methods? And if they ask these two questions, they easily can find out that genomics is one of their best friends that they can have. So for example, if a patient comes in and they say like they have difficulty in bowel movements or something, one of the first thoughts that comes into the physician's head, especially when the person is above 50, they're thinking probably colon cancer. The next question can be, okay, is there anybody else in your family who has had similar problems? That immediately brings up the question of genomics. And they can say, okay, I have a solution that can be applied to this person and that can make this person's life much better than conventional diagnostic methods. And so they can quickly identify that this is one of their best friends in town. The genomic perspective is not very different from what they are regularly trained for in clinical practice. When they look at an objective view on the patient, they view them as a comprehensive person. They bring in their opinion on their signs and symptoms, and they use their laboratory information to make the best judgment they can make on what could be the condition and how best that they can treat. This is exactly the same perspective they need to bring into the genomics idea. Let's use his genomic information as one of the pieces that is being brought into the picture and use that information to best treat the patient. So you can use general biochemical understanding, the signs and symptoms, their history, and the genomics, and together this brings a very nice picture and easily identify how they need to proceed to the next. So India has a very large endemic sickle population. It's very widely spread, especially in the central part of India. And my work has been primarily to get the sickle gene, a corrected version of the globin gene, which is what's mutated in sickle disease, into the patient. So what happens is they are actually cured. When you do regular pharmacology, you take a pill, and as long as you're taking a pill, you are fine. And the moment you stop taking the pill, you are not. You go back to your stage. Gene therapy, what I've been working on trying to get the FDA to approve these, is a cure. And I would like to stress the word cure, because once you give them the gene therapy, their cells are cured. They will never become sick again. And this is something that India can definitely use. And recently, last year, Prime Minister Modi went to Japan to sign a treaty on this. And we can use endogenous population, Indian population, and I can provide my ideas. I've actually mailed Prime Minister Modi on his email services to use infrastructure that's already there. There is Temputix, there is Life Cell Technologies, a lot of different industries which are interested in doing this and getting this to the patients. And if only the idea can be brought to fruition and the institutions can be given the help to take this to the field, that will definitely cure a lot of patients, a lot of patients, especially in the tribal regions of India. So it's a question of policy and the idea that the physician is still in the practice of medicine. It's not perfect. So if they can make sure that the physician can take as much help as possible to make sure that they make a very accurate diagnosis, and that they are allowed the flexibility to use as many resources they can to come to as close to a perfect diagnosis as possible, that will definitely help the physicians take the next step. And they can also make genomics a higher priority in their medical education. It's the way where things are going, that the physician needs to get a better understanding right from their ground level to how to inculcate the genomics data into their clinical practice. That should be definitely made into a policy, especially by the governing councils that guide the medical education in India. That can definitely make a big difference. Genomics is rapidly growing, and it is going to be a mainstay. Just like you do biochemical tests, the next step is going to be genomic testing. It's not going to get there rapidly, but it's going to get there fairly soon. In the sense, we have had eminent physicians and physician scientists talk about having a panel of genes that they can sequence quickly, like within 24 to 48 hours, and then tell the patients like, okay, this is where you stand. And that is very similar to what we do in blood tests. So you give a blood, 2 days later you already have all your results. That's where genomic medicine is getting, and that's going to eliminate a lot of doubts about where exactly your diagnosis is falling, and it's going to make a lot of things very clear. And it is definitely imperative the physicians start taking account of this and taking the benefits that they can achieve from using a genomic testing.